Welcome to the overview of the Baby Talk approach and curriculum for birth to 5. The purpose of this brief overview is to provide key information for decision makers who are selecting a family engagement curriculum to implement within your center-based programming. In coordination with the Department of Family and Support Services, we are providing this information as an introduction, and we look forward to answering any follow-up questions you may have. My name is Ellen Walsh, and I am the Learning Institute Director at Baby Talk. Along with my colleague Karen Dennis, the Baby Talk Professional Association Manager, our goal for this overview is to provide you with enough information to help you understand our approach and curriculum while not overwhelming you. Our hope is that this overview provides you with enough information as you think about how Baby Talk may fit within your program in support of effective family engagement and the holistic role of your family support specialists and family support workers. Since its inception over 30 years ago, Baby Talk, the acronym TALK stands for Teaching, Activities for Learning and Knowledge, has been implemented to serve families birth to 3. The curriculum was expanded in 2016 to include pre-K. While the family engagement approach has always been applicable across all ages, with the expansion of the curriculum, we are able to fully support professionals and programs serving families birth to 5. It is clear from what we are beginning to know and learn about the expectations of the family support specialist within your centers is that this role is all about the many layers of relationships. We know school readiness is our shared ultimate goal for children and that it must be done in the context of parent, family, and community engagement. We want this overview to help you understand the role of Baby Talk in training and supporting staff to build trusting relationships within each of the layers, and especially with families to fully engage in ensuring their children's school readiness. The Baby Talk approach is centered on the importance of infant mental health, and with that, we are all about relationship building strategies. We liken the way a child builds trusts in their first months of life to the way in which families build trust with us as they engage in early care and education services. You are already providing high-quality learning environments for young children. So we must think, how then will we ensure we continue to build effective relationships with parents to further support the development of their children? Baby Talk key methods and approaches include the following: nurturing families in support of optimal early child development, applying a developmental approach to family engagement, facilitating parent-child interaction, affirming parental competence, using active listening, reflection, and strength-based strategies, and finally, building community connections. The distinctive features of Baby Talk include a proven history of identifying families with the greatest risk factors than other targeted programs of its kind. Effective approach for professionals to identify at-risk families early and to implement supportive services. Extensive protocols to guide effective encounters with families. And finally, flexibility to tailor protocols and curriculum based on the needs of each family. In thinking about the role of family support specialist, we understand we need relationship-based recruitment and enrollment. We need collaborative partnerships within all layers, family, community, and within the center itself. We need to have methods to effectively engage families in screenings, groups, individual encounters, family assessments, and goal setting. Sometimes, when we think about family engagement specifically, it may feel like just another thing our centers need to do. To assist us in shifting away from feeling like it is a burden and to ensure our professionals feel supported in their work, Baby Talk provides tools and strategies for staff and the center to have a culture of family engagement. Every time we have a conversation with a family member, it is about engaging them in their child's development. Family engagement is not something we do, like family night or a parent workshop, but it is how we are with families in every conversation and discussion. Professionals receive these strategies for engagement embedded within these critical concepts. Tell Me About Your Child is our way of recognizing the parent as the expert of their child, inviting parents to help us learn what they know about their child, and letting the agenda not be driven by our own preconceptions or ideas of what we think they may need. We are putting the parent in the expert role, the role of lifelong educator. Going where families are means both physically and emotionally. As we think about outreach and recruitment, where are families in the community, and how do we have meaningful engagement that may lead to enrollment? If we think about screenings, what does it mean to go where the family is as they have emotions and reactions when there may be concerns? Coming alongside families is so important as we know each family is in a different place, has their own family culture, has their own strengths, and their own challenges. We do not want to push or pull families where we want them to go. We must engage and work collaboratively with them as we think about family partnership agreements and monthly visits. Our curriculum falls into two categories, both research-based. The first category includes curriculum designed to facilitate the direct interaction between parents and children. This curriculum is not a step-by-step prescriptive way of directing parents to interact. Rather, it involves asking reflective questions to understand the parent's perspective in the context of the activity. This curriculum is made up of over 370 individual activities birth through age 5. The second category allows for support, engagement, and reflection with parents on developmental topics across all developmental domains, as well as parenting issues, issues related to trauma, and more. These sections of the curriculum are made up of over 270 pieces of curriculum. Our curriculum is available in both English and Spanish. It is easy to access, robust, and most importantly, flexible to meet individual family needs in support of where they are and the goals they have for their parent-child relationship and child development. To describe our curriculum further, we have a brief description for each of the sections. Preschool themes is reflective and for conversations with families with preschoolers related to social-emotional development, language development, and more. Next, the preschool activities, aligned with the Illinois Early Learning and Development Standards, are parent-child activities in support of the domains listed here. Note that social-emotional development is not listed here. That is because social-emotional implications are embedded within each of the activities. It does not stand alone, rather it is a component of all interactions between parents and their children. For families with children birth to 3, the reflective curriculum, called Developmental Perspectives, is a monthly perspectives reflective document that covers the perspective of the child at that age, the perspective of the parent of the child at that age, and the perspective of the professional engaging with that parent of that child. To support parent-child interactions, their curriculum includes developmental activities aligned with the Illinois Early Learning Guidelines. A variety of sections support both individual and group parent-child interactions, including homemade toys, lap sits, family fun times, and come sign with me. The robust prenatal and newborn curriculum is supportive of families with very young babies and for families welcoming a sibling of a child currently enrolled in programming. Parenting Issues covers common areas of discussion to support families as they encounter what we know to be typically challenging times. Also, as we know the families we serve are often facing multiple risk factors or vulnerabilities, our trauma-informed curriculum provides professionals with a comprehensive set of questions to reflect with families related to supporting resilience for their children in times of trauma. Resilience is addressed through reflection related to strategies for supporting family routines, attachment, self-regulation, emotional state, and behavioral changes, as well as exploring ideas to develop a system of support. In our handouts, you will see some samples of our curriculum. Note that the samples include the Baby Talk protocols that guide professionals in consistently applying a relationship-based approach with families. We have crosswalked the curriculum with the Illinois Early Learning Guidelines. the Illinois Early Learning and Development Standards, as well as Teaching Strategies Gold. In our handouts, you will see some alignment documents for further review. We have alignment between PFCE outcomes and Baby Talk, Head Start Early Head Start relationship-based competencies alignment, as well as a sample parent, family, and community engagement service plan. In 2014, and in collaboration with professionals within our network, we adapted the Baby Talk Model Fidelity Self-Assessment to apply more specifically to center-based professionals and the center-based system of support for families. It is available to be completed online as a team or individually. Beyond the self-assessment, our training and technical support staff work with programs to review and reflect together. If you are interested in seeing this tool, we are happy to send you a copy. Next, to talk about our research. We recognize the need for research and evidence to articulate that our support of professionals in this field is effective in achieving positive family outcomes. To this end, we have a number of research projects and much evidence gathered under the leadership of Dr. Amy Hilado, as well as in collaboration with the American Institute of Research. We have summarized our research in this by the numbers view. We have a total of 3 randomized control trials, including 751 participants across these studies, as well as 7 descriptive studies. With over $1 million invested and a dedication to gathering evidence, we have engaged collaborators to get to 7 research grants, 9 research sites, each supported by 14 investigators and consultants. In our supplemental handouts, you will find a document that provides you more detailed information on this summary of our latest randomized control trial that studied the effects of services for refugee and immigrant families. We note here that we have included families with characteristics we expect to encounter in our work. The positive impact areas include a number of outcome areas that we also know to be important in our support of families. Through multiple RCTs or randomized control trials and our work and research at Refugee One, working with immigrants and refugees, we have demonstrated that our approach is culturally sensitive and we train and support professionals as they work with ever-changing diversity in the families we support. Core to the practical application in any environment is understanding that the families we serve change over time and become more diverse. Cultural humility and recognizing our own lens is critical as we think about building strong partnerships with families. Finally, while we recognize the passion professionals bring to this work, we also recognize working on behalf of families is demanding and often challenging. We know that work in this field is difficult as professionals need a complex set of knowledge, skills, and dispositions to engage in the many layers of relationships, using strategies and adjusting to individual relationships. So ultimately, professionals need someone to reflect with on their work with families. With our critical concepts, you have a clear framework from which to think about the work and what the experience is like for professionals. We'd like to thank you for listening to this overview of the Baby Talk approach and curriculum. If you have any unanswered questions or you do not have access yet to the handouts we referred to in this recording, please contact us at any one of these email accounts or at this telephone number. We look forward to hearing from you if you do have any questions. Thank you.